Students, today for topic for lecture class will be on Integrated Child Development Services. I am Dr. Mercy, Assistant Professor in the Department of Community Medicine, Sri Lakshminarayan Institute of Medical Sciences, affiliated under the Bharat Institute of Higher Education and Research. So moving on to the topic proper, the specific learning objectives of this session will be, at the end of the session, the students must be able to list the beneficiaries of ICDS, list the services provided by ICDS, describe the ICDS scheme, explain the ICDS Anganwadi Center norms. So the outline of my presentation will include the introduction to the topic, what is the purpose for initiation of this Anganwadi Center in the ICDS program, and what are the objectives of this program, and who are all the beneficiaries, what are the package of services that is being provided by this ICDS program, and the population norms under which this is being decentralized, and who constitutes the ICDS team, and what are the funding and training services provided. Finally, the monitoring and supervision of this program with the international partners. So starting the session with a small quiz or a buzzing session. Can anyone expand ICDS? So ICDS comes under which department? Can anyone tell about these two terms or these two questions? Okay. So ICDS expands as Integrated Child Development Services, and it comes under the Department of Social Welfare. So moving on to the topic proper. So under introduction, we will see what does this ICDS scheme constitutes. So ICDS scheme is one of the flagship programs of India, and it's one of the world's largest and most unique programs for early childhood development. So it is the foremost symbol of India's commitment to her children as a supremely important asset. And it comes under the Department of Social Welfare. So this answers our previous quiz session. So it comes under the Department of Social Welfare, and ICDS expands for Integrated Child Development Services. So what is the purpose of initiation of this program? So the purpose of initiation is mainly to provide the routine MCH, that is the maternal and child health services, not reaching the target population, and nutritional component which is not covered by the health services. Next is there is a need for community participation. So whenever there is community participation, any program will have its utmost and full coverage of services. So what are all the objectives of this program? So mainly to improve the nutritional status of preschool children, that is from 0 to 6 years of age, and to lay the foundation of proper psychological development of any child, and to reduce the incidence of mortality, morbidity, and malnutrition, and also to prevent the school dropout. And finally, to achieve the effective coordination and integration of all the policies. So these are the objectives, along with to enhance the capability of the mother to look after the health and health education. So moving on to the beneficiaries, who are all the beneficiaries who comes under the ICDS program? So children less than 6 years, pregnant mothers, nursing mothers, women of 15 to 45 years of age, adolescent girls, that is from 11 to 18 years covering. So these are all the beneficiaries of the ICDS program. Next comes the package of services. So the main package of services provided by this scheme will be the health checkups, immunization, growth promotion and supplementary feeding, early childhood care and preschool education, nutrition and health education, and finally the referral services. So these 6 are the package of services under these schemes. So can anyone list the beneficiaries of ICDS and list the services provided by ICDS? So I will be telling the answer. So the beneficiaries of ICDS are the children under 6 years of age, pregnant mother, lactating mothers, adolescent girls, reproductive age group women, and under 5 children. So these are all the beneficiaries of ICDS. And services provided, as we have seen, it's a supplementary nutrition, health referral services, health checkups, maternal benefits, and care, immunization, and finally the preschool education. So these are all some of the services provided by ICDS and the beneficiaries. So coming into the topic of health checkups, so they mainly record the weight and height of the children who are all under the Anganwadi centers. And they watch over the milestones. So whether the child is getting the proper milestones at the required age. Then they give the immunization of the prescribed age group. So depending upon the national immunization schedule, they give the immunization. Then is the national deworming. So every 6 months they give the deworming tablets of albendazole. It is 200 milligram for adults and 200 milligrams stat for under 5 children. And also they give the general checkup for detection and treatment of the locally endemic diseases. Okay. Finally, they may also give the prophylaxis for vitamin A deficiency and anemia. So vitamin A deficiency, they give prophylactic syrup, whereas for anemia, they give the iron tablets. So weekly iron folic acid supplementation. And they also refer the serious cases to the tertiary care centers. So these all comes under the health check. And they also care for the antenatal mothers who are all the expected mothers for MCP protection, that is maternal and child protection services. And postnatal care is also given to the nursing mothers and for the newborn infants. So these are all the services provided under the health check. Next, moving on to the immunization. So as I said, they mainly immunize for the vaccine preventable diseases under the National Immunization Schedule. So these services are provided by the Anganwadi Center workers or the ANM or the VHN from the primary healthcare centers. So this is the in short about the national immunization schedule. At birth, we give the BCG and oral polio vaccine and hepatitis birth dose. And 6, 10 and 14 weeks, we give the OPV, pentavalent and rotavac vaccine and also the pneumococcal conjugate vaccine. 9 to 12 months, it is the MR vaccine 1. And 16 to 24, it is the MR2 along with PCCV booster and OPV booster. 5 to 6 years, we give the DPT booster 2. And 10 and 16 years, we give the tetanus toxoid. So this schedule also includes the pregnant mother who is given the tetanus toxoid. Next is the supplementary nutrition. So the main aim is to provide the calorie and protein deficit. So fulfilling the calorie and protein deficit of the children who are all attending the Anganwadi centers. They mainly focus on children under 5 and severely or acutely malnourished children and pregnant and nursing mothers. So this is the take-home ration food that is supplied by the Tamil Nadu government, which includes under 400 grams given the nutrient value. And this is a model diet that has been provided at the Anganwadi centers. So mainly they will be giving a weaning food for the children who are after breastfeeding. So one boiled egg they will be providing and a noon meal which constitutes about all the grams, Bengal gram, bean gram and also the fruits and vegetables. So these are the model diet that is being provided. Next care service will be the preschool education. So along with the nutritional supplementation, they also provide preschool education. So that is a Montessori education at the Anganwadi centers. So non-formal preschool education comprises of children under the age of 3 to 6 years. Main objective is to develop a desirable attitude, values, and behavioral pattern among the children and organizing them to have a play and creative activity. Moving on is the nutrition and health education. So the nutrition is being given to the women of age group 15 to 45 years, and also to the expectant mothers and the nursing mothers. So they may be given health education regarding personal hygiene, breastfeeding, immunization, diet for the baby and mother, and growth monitoring services. So the health education will be given under all these headings under the Anganwadi centers. Next is the referral services. So mainly they focus on secondary prevention, that is early diagnosis and prompt referral during the health checkups, growth monitoring, sick and malnourished children and pregnant mothers, and for the postnatal mothers, and also for newborn babies. So any referral services is needed, they will be referring to the nearby secondary care or the tertiary centers. So what is the population norms under which an Anganwadi can be set up? So it differs under the rural and urban area and also the tribal areas. So for every 400 to 800, there will be a single Anganwadi, and for every 800 to 1600, there will be two Anganwadi centers, and for 6600 to 2400, there will be three Anganwadi centers. Whereas it differs in the tribal areas like 300 to 800, it is one Anganwadi, and from 150 to 300, there is a mini Anganwadi. Okay. So moving on, so it is mainly a centrally sponsored scheme, except for the supplementary nutrition, which also states takes care of. So who all comprises the ICDS team? So it is the Anganwadi workers, Anganwadi helpers, supervisors, child development project officers, district program officers, medical officers of the PHCs, auxiliary nurse midwife, that is ANM, and the accredited social health activities, that is ASHA team, will constitute the Anganwadi center. So this is a short about a quiz or buzzing session. So Anganwadi norms in a rural area, Anganwadi norms in a tribal area, and what comprises the ICDS team. So this you can write it as an assignment and submit. Okay. So who is an Anganwadi worker? So main Anganwadi worker will be a person from the local village or the local area who mainly monitors the growth monitoring, gives a non-formal education, and they also provide health education to the mother, and they coordinate with the local PHC staff for health checkup and immunizations, and also they help in treatment of minor illness. So these Anganwadi workers are supervised by Anganwadi supervisors called the Mukhya Sevika. So these are all workers who supervises about 20, 25 and 17 Anganwadi workers in the urban, rural and tribal projects respectively. So they visit an Anganwadi at least once a month and coordinates with the LHVs, that is a lady health visitors and nutritional and health activities. So for all these, there is a project officer who is called the Child Development Project Officer, who covers one community development block with a population of 80,000 to 1,20,000. So they supervise, coordinate and guide the work of the entire ICDS project as in charge, and they supervise nearly about 4 to 5 Mukhya Sevikas. These Mukhya Sevikas in turn supervise the Anganwadi workers. So they are also assisted by one or two assistants to CDPO. Okay, so they get the training mainly from the Anganwadi training centers. So mid-level training centers is given for supervisors, and National Institute of Public Cooperation and Child Development provides this training. So what are all the schemes that comes under Anganwadi or ICDS? One is the Kishori Shakti Yojana for adolescent girls. Next is the Rajiv Gandhi scheme for empowerment of adolescent girls. And next is the Indira Gandhi Matritva Sakyoj Yojana. So these are some of the schemes under the adolescent health, which comes under the ICD. So the main objectives of Kishori Shakti Yojana will be to improve the nutritional status and health of the girls under the age group of 10 to 18 years, to provide required literacy and numeracy skills through the non-formal stream of education, to train and equip the adolescent girls to improve and upgrade the home-based and vocational skills. Finally, to promote the awareness of health, hygiene, nutrition, and family welfare, and also the home management and child care. Okay. Next comes the Rajiv Gandhi Scheme for Empowerment. The main objectives are self-development and empowerment, improving the nutrition and health status, and finally the adolescent and reproductive sexual health. That is the ARSH clinic, which functions through this program. So they provide an integrated package of services like nutrition provision, iron folic acid supplementation, health checkup and referrals, and nutrition and health education. So finally, the Indira Gandhi Matritya Sakyoj Yojana, it mainly provides practices and service utilization during pregnancy, self-delivery and lactation. It encourages the women to follow infant and young child feeding practices, contributing to the health and nutrition of the pregnant and lactating mothers. So overall, the monitoring and supervision of these Anganwadi centers under the ICDS scheme. So the main unit or training unit is the Ministry of Women and Child Development. So some international partners for this ICDS is Government of India partners with the following international agencies to supplement interventions under ICDS. Mainly it is the UNICEF, that is United Nations International Children's Emergency Fund, Cooperative for Assistance and Relief Everywhere, that is a CARE project, and the World Food Program. Okay. So finally, we end this topic with a short summary. So the ICDS comes under the social welfare scheme. The main beneficiaries are children under 0 to 6 years of age, pregnant mothers, lactating mothers, women of reproductive age group, and adolescent girls. The services provided are preschool education, immunization, health checkups, nutrition supplementation, and referral services. So ICDS team will be provided by the Anganwadi workers, who are all supervised by Mukhya Sevika, and finally by the Child Development Project Officer. Okay. And we know the norms of distribution of this Anganwadi centers. So job responsibilities and functionaries, as I told, they maintain the registers, they help in growth monitoring, providing nutritional health education, immunization, and all the field work given by these Anganwadi workers. And what are all the supportive schemes? Mainly the adolescents health, that is the ARSH program, Rajiv Gandhi Empowerment Program for Adolescents, and the adolescent reproductive and sexual health programs. Okay, and who are all the international partners? As we seen, it is the UNICEF, CARE project, and the World Food Program. All these comes under the international partners. So this is a short summary of the today's topic. So you can write an assignment under these headings and submit it to the next class. Okay. So our Department of Community Medicine has these health centers. One is the Rural Health Training Center, which is at Kumarapalayam. Urban Health Training Center, which is the Krishna Nursing Home at Lospet, and Government Primary Health Center. We are in MOU with Katerikuppam PHC and Kudapakam PHC. So these centers also provide all these services which I have mentioned under these ICDS. Okay. So these are my references. A recent textbook of PAR, which is a 26th edition, and IAPSM is the 2nd edition. You can also view the Women and Child Development Ministry, that is the NHM website. Okay. So thank you.